Cystic fibrosis is an autosomal recessive genetic disorder, meaning both parents have to be carriers of the gene in order to pass it down to their children. It is approximated that 1 in 25 whites are carriers of the gene. Cystic fibrosis is the result of a genetic mutation in the cystic fibrosis transmembrane conductase regulator, or otherwise known as the CFTR gene, and it is located on chromosome 7. The CFTR gene, when working correctly, produces a protein that regulates the movement of chloride and sodium ions across certain cell membranes, called epithelial cells. Epithelial cells are cells that come from surfaces of your body, such as your skin, blood vessels, urinary tract, or other organs. They serve as a barrier between the inside and the outside of your body and protect it from pathogens. When mutations in the CFTR gene occurs in cystic fibrosis, abnormal chloride sodium transport across the mucosal surfaces of these epithelial cells is blocked. This leads to sticky, thick mucus buildup outside of the cell, and this thick, sticky mucus buildup in various organ systems, such as the respiratory tract, pancreas, GI tract, sweat glands, and other exocrine tissues, is difficult to clear out. This sticky mucus also traps bacteria, leading to an overwhelming inflammatory response and frequent infections. This is commonly seen in the upper and lower respiratory tract, making it very difficult for the patient to breathe. There is no cure for cystic fibrosis at this time, but with medications and lifestyle modifications, it is more manageable.
The signs and symptoms your child may be experiencing vary based on the severity of the cystic fibrosis. These symptoms can improve or worsen from time to time. Cystic fibrosis will most often present first with what we call a meconium ileus, and this is when a newborn is unable to pass his first stool after being born. Normally, this stool is thick and greenish-black in color. However, in newborns with cystic fibrosis, this will be even thicker and stickier, causing a blockage in the intestine and therefore not allowing the stool to be passed, possibly causing further problems in your child. Your child may also have foul-smelling stools that are loose and greasy in texture. Your infant may be colicky or appear uncomfortable, and this can be related to constipation, bloating, and abdominal cramping that he or she may be experiencing. Because cystic fibrosis causes your child's mucus cells to produce secretions that are thicker and stickier than normal, your child may also present with frequent respiratory symptoms. This can include cough that can be chronic, and he or she may have thick, sometimes bloody phlegm along with it. He or she may also have difficulty breathing, shortness of breath, or wheezing, with frequent respiratory infections, such as pneumonia and bronchitis. He or she may also have frequent stuffed runny nose, with nasal infections that he or she may notice will have sac-like growths inside their nostrils. These are called nasal polyps. Your child's skin can also taste salty. Some parents of children with cystic fibrosis have commonly reported that when they kiss their child, it tastes salty to them. They may also report that they can become tired easily or are unable to participate in activities due to becoming fatigued very easily. So do be aware of that. Patients of cystic fibrosis will also have common decreased growth and weight gain, despite having a normal diet and having a normal appetite. Unfortunately, this will lead to delayed physical development, including having a delayed puberty. Some male patients with cystic fibrosis can also be infertile as well.
All right, so now let's talk about the prognosis for cystic fibrosis. The child born with cystic fibrosis can expect to live a fairly normal life up until adulthood. The current expected lifespan of a person born with cystic fibrosis is about 37 years of age. This means that they can go to school, finish college, get a job, and even get married. The disease progresses fairly slowly, and it degenerates the respiratory system to the point where the person normally passes away with a diagnosis of respiratory distress. Risk factors for cystic fibrosis are fairly minimal. Cystic fibrosis is an inherited disease, so it runs in families, and it is most common in those of Caucasian nationality, which is especially common in those of Northern European descent. So as far as diagnostic testing for cystic fibrosis, there are 3 tests that are done. And every state in the United States currently does a newborn screening for cystic fibrosis. It is a blood test in which they test for something called immunoreactive trypsinogen, or IRT. And what they do is they check for higher than normal concentrations of this enzyme that is released by the pancreas. Unfortunately, this is not a definitive diagnostic test that can be done. So a second test that can be done is once the child is 2 weeks of age, a sweat test can be done in which a chemical is placed on the skin of the child and it creates sweat, and that sweat is then tested for higher than normal levels of salt in the sweat. And the final test is genetic testing to look for genetic abnormalities that would point to cystic fibrosis. All right, so here we have our 2-week-old infant who is in for a sweat test. So we'll go ahead and unwrap the infant. Expose the arm here. Got our alcohol swab. We'll cleanse the area to be introduced to the chemical and let that dry. We'll then introduce the chemical that produces the sweat. And then after a period of time, we will come back and we will swab the sweat that is produced and send that off to the lab to test for sodium concentration.
Hi, my name is Riley. I'm going to be the nurse going over cystic fibrosis medications and treatments with you today. I know that you've gotten a lot of information today, so I'm just going to give you kind of a brief rundown of common medications and common treatments for kiddos with cystic fibrosis. And, you know, while there's no cure for cystic fibrosis, there are a lot of medications and a lot of treatments available to help manage that disease and improve quality of life and prolong life. And it's important to note that cystic fibrosis is, the treatments are not one size fits all. You know, what works for one person may not work for another. There may be personal preferences, and those may change as we move along and as your child gets older. So the cornerstones of cystic fibrosis treatments include infection prevention, loosening and removing those lung secretions, maintaining adequate nutrition, and preventing blockage of intestines, because all those extra secretions that you know, we see with cystic fibrosis patients, those can clog the lungs, clog the intestines, and can cause problems. So for as far as nutrition and GI goes, it's going to be, you know, one of the most common cystic fibrosis medications is pancreatic enzymes. So we're going to give those with each meal and each snack to help promote digestion. And those can also be used in combination with stool softeners and acid reducers to, you know, keep everything moving in the right direction as much as possible. It's also important that they get adequate nutrition in addition to those pancreatic enzymes, because the enzymes aren't going to do any good if they're not also getting good nutrition. Now, as far as managing pulmonary problems, infection prevention is going to be big, so really diligent hand hygiene for the whole family. And if we suspect any kind of lung infection, we are going to get sputum testing for targeted antibiotic therapy to take care of that as quickly as possible. But for just our day-to-day pulmonary maintenance, our biggest treatment is going to be chest physiotherapy and breathing techniques. And there's a lot of these, and what you like, what your child likes, what works is going to vary. Basically, what we're going to be doing, and I'm going to demonstrate with my dolly friend here, is just providing percussion in all the quadrants, back, sides, fronts, and sides, all around, to help loosen up those secretions. Now, you'll see some people use like a percussion tool. This is not it, but it's similar to help loosen up those secretions. You can do it just like if you were burping any other baby. You can also use just a cupped hand to do that percussion, and you'll do that all around, and you can do that 1 to 2 times a day or as much as needed. And then after you've done that, if you need help loosening secretions, you can just use a regular bulb syringe, just like you see at the hospital, and you can suction their nose if they need help. All right, so the last thing I'm going to go over with you guys today are those what we call CFTR modifiers and genetic testing. So as you have already heard, the CFTR gene is basically what causes cystic fibrosis. So what basically all the newest research is that we can do genetic testing on your baby, and that genetic testing will tell us what specific kind of CFTR gene that they have, and then with that information we can give a more targeted treatment with medications in a class called CFTR modifiers. Now there's 4 different kinds, and those kinds do have different age restrictions and are indicated for different types of CFTR genes. So once you get that genetic testing done, your provider will have a better idea of which CFTR modifying drug is best, and then you'll learn more about it from there. Another thing to always keep an open mind about in cystic fibrosis is that treatment research is ongoing constantly. And so clinical trials may, if you desire, may be a part of your treatment plan, because there's always new research ongoing with cystic fibrosis. And like I said in the beginning, it's not a one-size-fits-all disease. And so your treatment is going to change based on your preferences, based on new science, based on new medications, based on new information from that genetic testing. So if you have any questions, please reach out. And like I said, this will learn and grow and change as your child does.
Hello everyone. For this section of our presentation, we're going to be diving into what life is like with cystic fibrosis. While the diagnosis of cystic fibrosis is often confirmed while the patient is still a child, the onset of symptoms become progressively more apparent over time. There are no reasons to keep our children with cystic fibrosis from attending school like any other child. However, patients may face additional challenges when it comes to feeding, treatments, regular procedures, persistent infections that may require hospital time. Because of this, patients need to skip school on occasions. Some parents may even prefer to homeschool their children. Another challenge for our adolescents with cystic fibrosis is the onset of puberty, and menstruation can be delayed by a few years. Additionally, children with CF tend to be smaller and thinner than other children, and the feeling of being different based on these body image stereotypes. This is a very traumatic stressor for many of our children with cystic fibrosis. It is important for caregivers and parents to pay attention for patients who might neglect their treatments in order to not feel different than their peers. Transitioning away from childhood to adulthood with cystic fibrosis, balancing symptoms, treatments, studies, work, family, emotions, and social life can be a daunting task for anyone, let alone someone dealing with this chronic illness. Performing this balancing act results in the likelihood of psychiatric problems such as depression and scoring poorly on normal daily functions of life. Even though there's no cure for cystic fibrosis, the treatments that improve patients' quality of life and life expectancy have been improving through the years. The life expectancy is now 37.5 years on average. There's been many great advances in the past 100 years. Medications and therapies are not the only way to keep our CF patients healthy. Lifestyle is also important. The main lifestyle recommendation from the National Institutes of Health include not smoking, avoiding tobacco smoke secondhand, washing hands often to reduce the lower risk of infection, exercise regularly, drink lots of fluid, and chest physical therapy. Even though our patients may find it difficult to be physically active, it is shown that keeping active has benefits like increased tolerance of respiratory muscle, sputum expiration, reduced residual volume, the rate of a rate of decline in pulmonary function is not prevalent. Improvements in fluid balance and retention of serum electrolytes, and the lower risk of early death. While patients with cystic fibrosis do not have any barriers to normal sexual life, the majority of men are infertile, and the women have difficulties conceiving. However, with modern fertility treatments, we've been able to help this process. In addition to these complications, patients might also face challenges in different aspects of their life, such as traveling. Cystic fibrosis does not prevent people from traveling, but there are preparations and planning that need to be done in advance. Patients need to consider potential symptoms, exacerbations, medications for the trip, and the length of time of the trip, immunizations, and special care at that location. Well, that's a little bit of diving into daily life with cystic fibrosis. Thank you, everyone.